Welcome to another edition of Senior Talks, an exciting new educational program for those age 45 and older in the Harris County area. Senior Talks features presentations on opioid use, medication management, recovery, and health. Senior Talks is sponsored by the Harris County Area Agency on Aging and the Council on Recovery's Wellderly program. Today, we have Leah Bell, older adult recovery coach for the Wellderly program, here to share with us ways we can identify addiction in older adults. All right, Leah, take it away.
Okay, hi, and thank you for joining us. In identifying addiction in older adults, let's first review what we've learned in our last segment of what is addiction. All right, so 40 to 60% of addiction is due to genetics. So it's simply in our genes. Also, there are other factors, which includes your family's history and their attitude towards taking drugs, your community, the community that you live in, attitude towards using drugs, being raised in a chaotic home environment, abuse or neglect as a child, the age which the initial use was experienced. Now, not everyone's initial use will lead to addiction. It simply is based on that individual's circumstances and their factors, their risk factors, the number of their risk factors. Now, how addiction is formed. Well, it is formed in phases. So, of course, the first phase would be that initial use. So say the person experienced that initial use of substances, which let's just say, for instance, their opioid painkiller prescription. And that individual begins to take more than what is directed on the bottle or by the physician or the pharmacist. Let's say, for instance, the physician prescribed you an opioid and is directing you to take one pill every 6 hours. Well, that individual takes 2 pills every 4 hours. And over a period of time, there is a tolerance to that opioid. And at that phase, it is a clear indication that there has been a change in your brain. Over a period of time, abuse turns into tolerance, and over time, then that abuse turns into dependency. This is where the individual actually needs that opioid in their body to feel normal. And without that opioid, that person feels what is known as withdrawal symptoms. And at that time, the individual will take that substance not to feel those withdrawal symptoms. So now, over a period of time, the body becomes so accustomed to that opioid, and it's needed. And again, that is dependency. There is a very fine line between dependency and addiction. So you can be in full-blown addiction and not even recognize it because it's so subtle. So full-blown addiction is when you continue to take that opioid despite the negative consequences that it is causing you. For instance, you may be experiencing trouble with your relationships. You may have experiencing trouble with your job. You may be on the brink of losing your job, but you cannot stop using. That is full-blown addiction. Now, for the older adult, there are 2 classifications for substance use. The first classification is called early onset, which is also known as the hardy survivor. Now, this classifications of substance abusers are older adults who have been using substances for many, many years and have reached the age of 65. Now, the second classification is called late onset. Now, this is where the older adult develop an addiction later in life. And some causes for that triggers addiction in older adults later in life is retirement, losses due to your spousal's death of a spouse, separation, divorce, separation and divorce, maybe moving from your home, being forced to move from your home, or even being placed in a nursing home. Also, having trouble sleeping at night. Individuals can develop an addiction due to that, you know, not being able to sleep, depending on the medications they are prescribed. Along with all of those outside or outside issues, there's a physiological change in the body that renders older adult more at risk for developing addiction, or more susceptible to the effects of drugs and alcohol. The body has a decrease of body water, and it has an increase of body fat. And so which means the substance stays in the body longer and the effects are felt longer. This also means that the amount of alcohol you could have drank when you were younger without even feeling an effect from that, at this point, you can drink that same amount of alcohol and become intoxicated. Now, there are also an increase in your sensitivity, in the older adult sensitivities, and a decrease to tolerance. So remember, we spoke about tolerance, and tolerance is being where your body developed a stage of where that substance no longer provides that desired effect. So now you need more. Okay, and also there's the body is not able to metabolize and eliminate that substance quickly or within normal amounts of time. So the blood alcohol level stays higher for a longer period of time. And since the body cannot rid itself of these toxins from the substances that the body is maintaining, it can affect. And since the body cannot rid itself of the toxins that are in the drugs and alcohol, the effect lingers in the brain. It lingers in the brain as well as in the body. And this is also very dangerous because this causes an increase in hypertension and your heart rate. It impairs the immune system of the older adults. Cirrhosis of the liver can form due to lack of liver function. There could be a decrease in bone density. There could be a decrease in bone density, and there could be gastrointestinal bleeding. Also, what is experienced could be depression, anxiety, and other mental health challenges. Now, there are warning signs of addiction. However, these signs are subtle because they gradually happen over time, but they are there. So if you witness your loved one, or if you experience drinking alone, or drinking despite the warning sign, the warning label on your prescription bottle not to mix with alcohol, neglect of personal appearance, gaining or losing weight, having unexplained burns and bruises, seeming depressed or more hostile than usual, losing their memory, losing things and can't find them, or if you hear them complain on about constant sleeplessness or loss of appetite, or have chronic health complaints that seem to have no physical causes. All these can be indicators that you or your loved one could be battling addiction. All these can be indicators that they or you may be battling with an addiction. Hope is not lost. According to a documentary film entitled Anonymous People, they report that there are 23.5 million people living in long-term recovery from drugs and alcohol. So if you or someone you know needs help or further information, please contact us at the Council on Recovery or call the Wellderly program. Information will be provided on the screen. This concludes our presentation. Please stay tuned for our next segment on Seniors Talk. Thank you.